So, sorry I had to play off the last video here because it got a little bit of a max time limit there, so sorry. So, we talked about rehabilitation, return to play. So, once they return to sport, I'll just redo this slide. So basically, you're gonna have we'll do the review one more time. Immobilization for 2 weeks, so that's basically bed rest. Have to make sure that the hip is staying in place. Making sure that we're letting it fully recover, because we can't usually let something like that get too active right away. Kind of like with like a brain surgery or a back or neck surgery, you have to let it kind of let it heal for a little bit. Lots of rest. Use of a crutch for a month or even longer, depending on the severity. After that, after crutches, progressive range of motion exercises will begin. So usually day one, it will involve non-resistant biking. So that could be for a couple weeks too. Maybe some elevation and depression movements to kind of get the quad and the hamstrings back working again. And then you'll start doing open chain to closed chain exercises. So we think open chain, basically, it's where the exercise can go on for a while. Closed chain has an ending point within the exercise. Next up will be running, cutting, and things of that nature. That will be a lot of times, I'd say maybe 9-10 months, maybe even a year. This is kind of, I think, a slower slower recovery rate, and then you can return to sport, and that would be usually maybe a year and a half. So important factors and complications to think about. So complications from hip dislocations are likely. These possibilities can include palsy of the sciatic nerve. So a lot of times the sciatic nerve is damaged with things like hip dislocation. So pretty much you'll have those tingling sensations going down your legs sometimes. That sometimes may never go away. That can also lead to osteoarthritis, avascular necrosis, and hip labral tears. That's basically, all those are kind of basically where the cartilage will start to degenerate. Blood vessels will not be able to get blood to that region. It's already a very low blood supply region, but when you have a vascular necrosis, it basically is going to allow the hip not to get as much as it once could, leading to other complications. Osteoarthritis is simply arthritis in the hip joint, which causes stiffness, impedes range of motion, and pain. Vascular necrosis is caused due to a hip dislocation disrupting the flow of oxygen to the head of the femur, causing blood and bone tissue to die, leading to joint bone deformity and bone deterioration. It's also known as a trauma-related vascular neurosis. Hip labral tears can be a result of hip dislocations in which the articular cartilage, which our labrum, is torn, causing the head of the femur to not move smoothly within the acetibium. Acetibium. Yeah, there we go. So that's my presentation. Here you go. There's my references. And good.